going to go through our laser consult that we do with new clients. I always use visual aid. Sometimes a picture speaks 1,000 words. So the way laser light works, the laser light is attracted to the dark hair bulb underneath the skin. Hair is in 3 different stages of growth at any given time. First, second, and third. It takes approximately 12 to 16 weeks for one hair to go through all 3 stages. So the hair is about a third, and a third. That's at each stage. So when you do laser, you can only kill that hair that has the big juicy bulb on it. That's the final kill. So you're only killing a percentage of hair with each treatment, and that's why you come back for repeated treatments. It takes, we do treatments once a month, and it takes anywhere from 8 to 14 treatments, is what I tell people. So it depends on how much hair you're starting with. So what we do is we do a test spot on a lower energy level and a higher energy level. Then we wait a few minutes, and what we look for is for that follicle, the skin around the follicle, to be red and raised, and that's how we know we have enough energy to kill that hair. After we wait a few minutes, we go on and finish up the treatment. The laser fires very rapidly. It feels like a rubber band snap on your skin. The pain is instant. It's there and gone. There's no residual burning. And no pain after you feel when you leave. Now the area gets red and raised, but by the time you drive home, that literally fades and cools off. If you get in the shower that night and take a hot shower, when you get out of the shower, it may be red and raised again, but it will go down, and that's the last time that you'll see that. When you're lasering, you do have to wear protective eye goggles, and you will smell burning hair. After I laser an area, the hair is stunted, so it doesn't grow right away. So what you have to do for me is you have to loofah or scrub vigorously with a washcloth. So if I lasered your face every night in the shower, you're just going to scrub vigorously with that washcloth or that loofah, and then you're going to moisturize. Because what happens when that hair is stunted is it tries to come up through the skin, but sometimes the skin grows over because it didn't grow for a couple days. So you just got to keep that follicle open, because ingrowing hairs are one of the side effects of laser. So that is easily preventable. After I laser you and the hair starts to grow again, you can keep shaving it. Don't pluck it out. It takes 7 days to push out of the follicle. So I laser you, it's stunted for 3 days, it doesn't grow, and then it slowly starts to push out of the follicle, and it's actually dead hair. So you can either shave it or just let it fall out. With each treatment, it becomes patchier and lighter and finer. Now we're going to let the doctor tell you about all the side effects of laser. The way that laser works, the laser light comes down and it's attracted to that dark hair bulb underneath the skin. So hair is in 3 different stages at any given time. First, second, and third. You can only kill the hair in that first stage of growth where that bulb is big and juicy. The second and third stage of growth, the bulb is dormant. So that hair will die and fall out, but it takes 12 to 16 weeks for one hair to go through all 3 cycles. So what's going to happen is we're going to do 2 test spots, a lower energy level and a higher energy level. What we're looking for is we want the skin to be red and raised. If it's red and raised, we know that we have enough energy level to kill the hair. After I laser you, that hair is going to be stunted right there. It's not going to grow for the next 3 days. So you're going to take a loofah or a washcloth and just scrub vigorously at night, just to prevent ingrown hairs, because the skin wants to grow over that when the hair is just sitting there. But it takes 7 days to push out of the follicle.
Okay.
What about sun exposure on him?
He
has been in the sun, not substantially so, but he's definitely been outside in the sun this summer.
Okay. Yeah, I might switch lasers. So, what we're gonna do, so what's gonna happen is it's gonna be stunted, and then it's just gonna push itself out of the follicle, and you can just either trim it like you were, don't pluck it, no more plucking, I don't know what you were doing, so just take a little razor and just shave it, and it'll eventually, in 7 days, it's gonna fall out, and it's dead hair that's falling out.
Okay.
So, the doc is going to tell you all the side effects of it.
Okay.
I'm Dr. Solomon, and like Elaine indicates, there's a need for repetitive treatments. Only a certain percentage of hair is actively growing. To put it another way, hair is in 3 stages. Stage 1, which has a vascular bulb and is actively growing. Stage 2, where the vascular bulb is involuting, and stage 3, where the hair is quiescent and falls out. Stage 2 and stage 3 ultimately recycle into stage 1. But at the same time, not burn the skin. So the first thing we do are test spots to adjust the energy level of burning. Having said that, some people will go on and get a burn. And that burn can be as bad as a bad sunburn where you actually blister or peel. If you do get blistering or peeling and it leads to infection or scarring, you want to prevent that. But if you do get the complication, you're going to treat the complication the same way that you treat a bad sunburn. You take something for inflammation and pain, such as aspirin, Motrin, Aleve, anything that makes you feel better. You want something to decrease the inflammatory response and help cut down on the pain. And for any blistering or peeling that you might see, you might consider using an antibiotic ointment like Neosporin or bacitracin, something to lubricate the skin, fight infection, and promote wound healing. For blotchy skin or irregular skin tone, the treatment is basically wait long enough, and in the average person, it's going to blend in all by itself. Like a summer suntan in July, don't look at it in August or September. Wait until January or February, and things for the most part tend to blend in all by themselves. In a nutshell, if you get a complication, do absolutely nothing, 99.9% of the time it's going to get better all by itself. 2 people in 20 years I've seen have an allergic reaction to the coolant spray that comes down. You know that you have an allergic reaction because you get little red itchy bumps. It's extremely rare. If you do get little red itchy bumps, don't scratch it. What you do is you go to the drugstore, you get yourself some cortisone, and you put it on just exactly as if you would get a poison ivy rash if you were out in the woods. That's it. Questions? Feels like a rubber band snap. You'll notice that.
That's what she was saying.
Some parts are a little snappier than others, depending on what you're having treated, but it feels like a rubber